Mr. Say Siong is a 52-year-old man who lives in Bukit Sentosa. A very cheerful and friendly person who previously worked as a programmer to support his family. He is a very hard-working man. He likes to travel around the world for holidays with friends when he has free time. However, his life changed because of a stroke. In 2016, Mr. Say Siong was diagnosed with a stroke. It all happened when he was out walking with his friend, and suddenly half of his body was quite difficult to move. He then drove the car to the hospital before being diagnosed with a stroke. This stroke has prevented Mr. Chu from moving around, and so he had to give up his job as a programmer. He also had to undergo several treatments to allow him to walk again. After a few months, he was finally able to walk and drive a car, but it was still difficult to walk as usual. He never gives up. He started a small business where he makes and sells very healthy sourdough bread. Watch this video for an interview with Mr. Chu and more knowledge about stroke. Enjoy!
Stroke. Stroke is a brain attack which causes your body to become paralyzed. It is a very common problem throughout the world. Everyone in 6 men and everyone in 5 women is at risk for developing stroke. It is the second highest cause of death and the highest cause of disability in the world. What happens in a stroke? In about 80% of cases, stroke is due to blockage of blood vessel and brain due to blood clot. In 20% of cases, stroke is due to rupture of blood vessel and brain. In both cases, parts of affected brain suddenly stop working. What causes stroke? There are many causes. Most important causes high blood pressure, especially long-standing and uncontrolled high blood pressure. Diabetes, high cholesterol and heart disease are also an important risk factor. Another important risk factor is tobacco in the form of cigarette, shisha, or even chewing tobacco. These factors over a period of time affect blood vessels of brain, ending up in either blockage or rupture of them. How do we identify stroke? Acronym for stroke symptoms is known as FAST. F stands for paralysis or drooping face. A is for weakness of arms or legs. S represents slurring of speech and inability to speak. If anyone develops one or more of these symptoms, suddenly they probably had a stroke. T stands for time, means you have to rush to emergency because in stroke, time is brain. If you lose time, you are going to lose brain. What to do if someone has a stroke? Take patient to emergency room as soon as possible. An urgent CT scan is needed to find out if it is due to a blood clot or rupture of a blood vessel or brain hemorrhage. If it's due to a blood clot, patient may benefit from a clot-busting drug called TPA. This medicine can only be given within 4 to 5 hours. Patient needs to be admitted in hospital, preferably in a stroke care unit. Blood pressure control and prevention of complications like pneumonia are mandatory. Long-term care stroke patient requires a long time to recover, usually months, and have a chance of recurrence of stroke. Long-term care requires daily medication prescribed by doctors. Abstinence from smoking or tobacco, rehabilitation, and regular exercise. Some patients may require surgery of brain or blood vessel. Take-home message stroke is preventable if risk factors are controlled, especially high blood pressure. Stroke is treatable. Most people can go back to work with correct treatment.
Mr. Chiu disahkan
47.
menghidapi penyakit stroke.
47
14
Tahun
so
lalu.
lebih kurang dalam 6 tahun lah.
Dalam 2016.
Betul, 2016.
Like something is not right with your body or health.
Tak ada simptom.
So macam mana Mr. Chiu?
Tiba-tiba sebelah badan lemah. Dia masa kena tu boleh lagi.
Boleh
Saya,
bergerak.
masa saya kena, saya masih jalan ke hospital, masuk hospital.
Maksudnya macam yelah before stroke ada banyak benda yang Mr. Chiu boleh buat kan. So lepas stroke tu macam banyaklah perkara yang Mr. Chiu tak dapat nak lakukan ataupun ada height or limit, like bekerja ke.
Memang tak dapat kerja lagi lah.
Selain daripada tak boleh bekerja, apa lagi yang Mr. Chiu?
Actually banyak benda yang tak dapat lakukan lah, because dia sebelah tangan dah lemah. Jadi banyak benda lah, kadang-kadang macam kita nak buka something macam botol yang ketat sikit pun dia jadi susah lah. Masa kena stroke, masuk dekat hospital Kota Baru. Malam tu dia transfer pergi HUSM. Lepas 3 hari transfer balik ke KL. Jadi tiga hospital. So all in all ada 2 minggu lebih lah.
Sampai sekarang Mr. Chiu masih menerima rawatan tak? Sebab sebelum ni Mr. Chiu ada cakap yang sakit stroke ni takkan sembuh sepenuhnya.
Ya, okay. Saya hanya follow up dekat klinik kesihatan untuk habis sambung monitor dengan ubat sajalah.
Pesan kepada Mr. Chiu daripada segi emosi.
Mula-mula takut lah.
Takut waktu kena tu takut lah.
Tak tahu stroke ni macam mana apa akan terjadi, masa saya dekat ward pun actually saya rasa better lah, because masa dekat ward tu dia dah sudah start bagi exercise semua kan. Macam dah faham benda tu.
Umur bila Cik Chiu dapat jalankan hidup macam biasa?
Okey, saya rasa saya agak cepat lah. Dalam 2-3 bulan saya dah boleh berjalan, dah boleh berjalan lah. Saya kena bulan 1, bulan 2 saya dah mula jalan tanpa tongkat.
Oh, Cik Chiu menjalani kemoterapi untuk berjalan balik macam tu.
Okey, faham. Saya ada buat acupuncture, saya ada buat physio dengan
macam Cik Chiu. Apa yang nasihat yang Cik Chiu boleh bagi dekat dia orang?
Okey, benda ni actually dia depend on dia punya kecederaan. Sebab dia benda ni dia berlaku dalam sel otak. Jadi banyak benda yang mungkin boleh macam kita tak boleh compare satu pesakit dengan pesakit lain. So dia kena actually dia depend on dia punya kondisi kecederaan dia, dan kalau sel otak lain boleh ambil alih tugas yang sudah rosak tu, then dia boleh recover better. Susah nak cakap, kita tak boleh cakap berhenti boleh baik. So kita hanya boleh usaha sajalah.
Terima kasih HRC, UPNM dan murid-murid HRC, UPNM dan pelajar. Semoga berjaya dengan cemerlang.